Knocking. Hello, my name is Lucy. Hand hygiene, gloves. My name is Lucy, and I'm going to be your daughter's student's nurse today. I'm going to do a head to toe assessment on her. I'm going to be listening to her and touching her, and I'll ask you some questions if I have one. And you're also welcome to ask me any questions if you have some. Um, are you okay for me to do my head to toe assessment on her? Yes? Okay, good. Thank you. Hello, what's your name? Amy? Amy, how old are you? 2? Okay, great. Mom, can you please give me the name and date of birth? So I will scan that with the name tag and just make sure that is right. And whilst I start my head to toe assessment on Amy, I'm observing Amy and looking out for any labored breathing or any retractions or difficulty breathing. So after doing that, the next thing I'm gonna do, I'm gonna explain to Amy what I'm gonna do. So Amy, I'm gonna listen to you and do a checkup on you, okay? But now give me your hand. I'm gonna shine this light in your hands. Can you see that? I'm gonna shine it in your eyes, and I need you to follow the direction of the light. So I shine the light into Amy's eyes. Hopefully she has pallor, that is her eyes are equal, round, and reactive to light. I make Amy open her mouth. I'm checking for hydration in her mouth. Her mouth is moist and pink. And I also see that her teeth are also in, so that's good. I also check in her nostrils. The mucus in there is also moist and pink, so hydration is well here. After doing that, the next thing I'm gonna do is I'm gonna listen to Amy's lungs and respiration. So I'm gonna listen to chest sounds here, and I'll be listening for any crepitus. And Amy's lung sounds are good. I'm also gonna listen to her heart. Right. So I hear her S1 and S2, no murmurs. I'm gonna go ahead and listen to apical pulse with the small side of my stethoscope, and I'll do that for 1 full minute. And the apical pulse is gonna be on the left side underneath the nipple on the fourth intercostal here. And that is also great. Now after doing that, I'm also checking and looking out for Amy's skin color, and her skin color is right with ethnicity. Whilst doing that also, I'm gonna listen to skin, I'm gonna feel for skin trigger. I'm gonna push her clothes down, and what I'll do is I'm also observing Amy's chest and making sure that chest circumference is fine, and there is no also any bulging in the abdominal area. There is no also labored breathing. I also check skin trigger by holding the tummy a little bit, and skin trigger is also good. After doing that, since I'm down here, I'm just gonna go ahead and listen to Amy's abdominal sounds and bowel sounds, and I will start from the lower right quadrant and climb up to the upper right quadrant. And bowel sounds are present. I also go ahead and palpate, feel for any tenderness. There is no tenderness, so everything is fine. Again, I'm looking here, everything is good. The other thing I forgot to do is also to check Amy's blood pressure. I'll use the small blood pressure cuff to check her blood pressure, and I also check her temperature on the forehead, temporal. So That's what I'll do. The next thing I do is also go and check capillary refill on her fingers here. Capillary refill, it's good. Then I'm also gonna listen to radial pulse bilaterally at the same time. I will come back to her fingers and also look out for any nail clubbing, just to make sure that oxygen is fine here, everything is normal. Then I'll come down to her pedial side. I'm going to listen to her pedial pulse. Pedial pulse is fine. And I also check for capillary refill on the toes also. That is also good. At the same time, I'll go ahead and look on the legs. I'm looking out for skin color, just make sure everything is fine. At the same time, I'm looking for any bruises or any falls or any injuries, and everything is fine. At this age, for Amy, developmentally, socially, Amy does parallel play. In terms of speech, she has about 300 vocabulary words. She has some sense of time, and she will usually say things like now. With fine motor skills, she's able to turn doorknobs, and she's able to stack blocks also. For gross motor skills, she's able to jump, she's able to run, and she's also able to kick. Also with play, she likes to play with push and pull toys. And again, in terms of socialization, or yeah, for social things also, she's very ritualistic. She's very ritualistic. She has a time for play, she has time for bedtime, and she has her toys or sippy cups that she uses. So that is all I have for my head to toe assessment. After that, I'll make sure the bed is low, the core light is within reach, and the bed is locked. Thank you.